So today I'm going to present to you the work of first group. One of the reasons we want to do this study is we want to assess the strategic. We want to do a strategic assessment of leadership, governance, and investment framework in digital health. A lot has been said, and this presentation builds up on the previous presentations. Our team members are those. I'm not going to read them. I will share the presentation. So background is that despite that Rwanda demonstrated a significant progress in health systems, such as the health strategy, we still have issues in governance, coordination of partners, interoperability of systems. We have a lot of systems and interventions that are ongoing in digital health programs, but their coordination is still weak. Hence, we want to do that assessment to see, to have that insight on what could be strengthened. On the strategy, the current approved strategy says something about strong government's commitment and multi-sector collaboration, led by notable institutions such as the Ministry of Health, ICT, or existence of TWGs. However, the same strategy doesn't really clarify very well the issue of governance and coordination, the part of role sharing, who is going to do what, where are they going to do it, and the availability of standards that we have are not really talking to each other or can provide meaningful communication. So problem statement: despite Rwanda's commitment to digital health, challenges persist in harmonizing leadership roles, governing frameworks, strategic investment related to digital health enterprise architecture, fragmented systems, duplicated efforts, as well as unclear governance mechanism that hinders countries' ability to deploy scalable, interoperable, and sustainable health information systems. So hence the urgent need to assess and design a robust and effective digital health enterprise, especially focusing on leadership, governance, and investment coordination as they relate to EA to inform national digital health strategy and implementation. So the challenges and problem statement we said is rooted into the no formal adoption of enterprise architecture related to digital systems. Limited capacity or authority to enforce EA standards across stakeholders. There is the issue of roles and responsibilities that I said earlier. There is weak governance structures for digital health, as well as the capacity of human resource. So our vision of this study is to investigate strategies for establishing a unified, interoperable, sustainable digital health ecosystem by exploring effective governance frameworks as well as coordinated investment approaches. These are the objectives that will guide us into this study. One is to evaluate existing leadership and governance structures, reviewing national strategy and investment frameworks that support digital enterprise architecture. The third is identifying gaps and provide strategic recommendation for improvement of enterprise architecture. So our guiding scope into those three scopes or areas, we build these as shown in front of you. However, I'm not going to read them all. I'm just going to pinpoint the key one. So on functional areas, there is leadership and governance. We are going to look about the mandates, accountability structures, as well as policy frameworks. We are going to look on a part of enterprise architecture and standards. we are going to look on the reference models, interoperability frameworks, as well as which standards are available. We are also going to look on human capacity as well as technical capacity, and monitoring and evaluating EA maturity levels, as well as tracking feedback loops. So on health scope, we want to see availability or the use of global health goods. We also look on public health surveillance systems, as well as support systems and other cost-cutting systems. On geographic scope, we are going to look on the coordination platforms from the higher level to the grassroots level, what is available and what could be enhanced. We are going to look on facility level. We are going to look at public hospitals, health centers, and private facilities implementing digital health interventions, and as well as partner ecosystem. So this is our proposed timeline as well as the budget. This is supposed to be done in a span of 8 weeks. And that's the estimated cost, in detailing what will be the usage of such a cost. So the guiding steps and questions that we will focus on this study will be on part of leadership who leads digital health and the EA, and our roles clearly defined. On governance, we look at structures and policies that exist, and if they are enforcedly, effectively managed or enforced. On enterprise architecture, is there any national EA framework that is there? Is it really aligned on our national priorities? Is it interoperable with existing systems that we have? Investment, how are the initiatives funded? We want to look at the funding that is already there. Is it matching the national priorities? Is it sustainable? So on the last one will be on capacity. Is there enough local expertise? We are talking about EA, but is there anyone who is going to really implement it at the scale that we want? And as well as the training needs that is really required. So our activity is going to be implemented in 3 strategic phases, showing activities and outputs, including mapping. First will be conducting comprehensive view of existing leadership and governance structures, mapping existing EA components within Rwanda digital ecosystem, as well as developing national roadmap for institutionalizing digital health enterprise architecture with stakeholders. So these are the outputs. I think I'm not going to read them because we'll be sharing the documents. And the last part will be stakeholders that we want to engage or will be focusing on in this study. One will be Ministry of Health, which is leading the national health policies, Ministry of ICT and Innovation, RISA, as well as National Institute of Statistics of Rwanda. So basically, this is our work. And thank you for the attention.
Our topic is about evaluating national e-health strategy implementation and its role in strengthening digital health governance in Rwanda. This is my team. And myself was presenting. I'm Baziga Gervais from the Rwanda Food and Drug Authority. The one who was not an IT-related expert, but at least after this course, I can now easily talk about all many things about digital. This my fellow colleagues. I'm a public health expert by background. I'm with Yvonne, my fellow colleague, Eddie, and Donata, who is not around as of now, but work together just to produce this presentation. And I do thank everyone from my team for their key valuable contribution to achieve this presentation that I'm presenting now on behalf of the team 2 or group 2. So the problem statements that after readings and seeing, we found that our government, the government of Rwanda, has prioritized digital transformation in health through its national e-health strategy to improve service delivery, governance, and access to quality care. Although notable progress has been achieved in the rollout of different health tools, including MRIs and others, but we highlighted some key challenges after readings, whereby the systems found that the systems do not connect well. There is a limited interoperability. You understand that now I can talk about interoperability as a previous non-expert in IT, but now easily I can just positively challenge IT people in terms of discussing the role of interoperability. We also find that there are challenges of stakeholders who are not well coordinated in digital health. And if these problems are not solved, Rwanda's goal of a unified and efficient digital health systems might be at risk, and that this could weaken evidence-based decisions making and reduce long-term health benefits. Our landscape analysis, we found that most of these areas are in between 2 to 3 areas, whereby the leadership and governance is ranked to the level 3, by which Rwanda has established strategies and policies to guide digital health development, and governance structures exist, but there is still a need for stronger collaboration across stakeholders to avoid any kind of fragmentation. To the strategy and investment, it's ranked number 2 or level 2. We found that a national strategy is in place, but funding, consistent implementation, and ICT infrastructure remains gaps. There is great alignment on investment with long-term sustainability, whereby these are required. That's why we found that the strategy investments are on the grade 2. The policy reforms and regulation. Rwanda has a strong policy and regulation framework, especially around e-health. However, practical enforcement and compliance are still developing, leading to uneven application across the system. The workforce, it's ranked 2. Digital health capacity is limited by insufficient training and sustainable funding. There is a need to strengthen human resources for health with digital skills to support scaling of e-health solutions. To the level of infrastructure, it's ranked on level 3. The government has invested a lot in terms of ICT infrastructure. While foundation infrastructure exists, more expansion is needed to reach rural and underserved areas within the country. To the services and application, it's in between 2 to 3. Rwanda has multiple digital health systems, services and applications, among others, including the HMIS, Open MRS, and others. However, integration of all these platforms is limited when the systems often operating silos. To the level of standards and interoperability, the systems like HMIS and Open MRS exist. They rarely communicate seamlessly, and the lack of strong interoperability standards which contributes to fragmented services and service delivery and limited data-driven decision-making. The root causes of the 2 issues which were highlighted, there are multiple root causes that were highlighted. However, due to the time constraints, it was highlighted, and then you'll be having a chance to go through all those issues that were highlighted as root causes of these 2 issues related to interoperability among health systems and insufficient coordination among stakeholders within Rwanda health systems. Looking to the National Digital Health Strategy, the strategy prioritizes 8 key digital health systems including platform for insurance, emergency responses, and others. There is also interoperability and cross-system coordination are central, ensuring seamless data exchange and integration across all platforms to enhance efficiency and service delivery. However, new technologies like the artificial intelligence, telemedicine, and predictive analytics will support coordinated data-driven decision-making, while capacity building shall equip the workforce to manage and sustain a full interoperability digital health ecosystems. The resources required to implement these projects, including, we just grouped them into three parts, whereby we think the technical assistance shall be needed. Here I mean experts just to support in the review and analysis and development, while tools shall be also required, including data for data collection, visualization, and reporting. And for sure, all these two needs financial resources to support all the required tools. So we found that Rwanda has become a leader in digital health innovation in Africa, which is supported by different policies and strategies aimed at improving the efficiency, accessibility, and quality of healthcare through digital technologies. Despite these advances and challenges, including fragmented health systems, there are limited coordination among stakeholders, and enforcing regulations still a gap. So while these strategic frameworks are in place, the actual implementation and impact on digital health governance are still limited, highlighting the need for better integration, monitoring, and alignment of digital health initiatives. Understanding all and addressing these gaps are very essential for strengthening governance and ensuring the digital health investments to deliver tangible benefits across Rwanda. So our vision and objectives are classified. We do have general objective and the specific objectives, but in terms of vision, our vision is by the end of 2026, we shall ensure that the national e-health strategy is fully updated, approved by all relevant stakeholders, and actively implemented across all key stakeholders, which shall be enabling a cohesive and efficiency digital health ecosystem. The objective is to evaluate the implementation of Rwanda National e-health strategy and its contribution to strengthening digital health governance, with two key sub-objectives or specific objectives, which will be to assess the extent of its implementation and examine the role of the e-health strategy in enhancing digital health governance structure, including coordination among others, and identifying challenges and enablers, which shall explore what is causing limited interoperability and weak coordination. The scope, we do have functional areas whereby we shall be focusing on e-health policies and strategy and governance. The scope in terms of health should cover digital health systems and service delivery, and the geographical should be limited to the ministry level and programs and institutional which are dealing with health-related interventions. The time frame, we do have different activities, including the review, the data collection, analysis, reporting, and review and finalization, whereby I shall be needing a budget estimated of 48,000 USD. The next step, including, we do classify them into different areas, including policy governance, implementation monitoring, interoperability, and coordination mechanisms, whereby we shall be focusing on evaluating how the e-health strategy shall contribute to strengthening digital health governance, measuring the extent of strategy implementation, identifying technical and institutional barriers, and assess how well stakeholders shall be coordinated. And at the end, the plan shall be advocate for formalized national digital health governance frameworks and policies, integrate monitoring indicators, develop national interoperability standards, and establish a permanent multi-sectoral coordination platforms. The activities and key outputs are classified in their area. We shall be implementing different activities per strategic area, and whereby we shall be having around 5 expected outputs if we implement all the plan that were developed as per the area of intervention. We do have different stakeholders with their different roles, including the Ministry of Health, the RBC, and the other government institutions dealing with health, the Ministry of ICT, the RISA, the facilities, health facilities which are providing health service to the community. We do also have our community health workers as our main key stakeholders in this area, the digital health companies, the development partners, academic research, and the patient for sure, our patients. And patients are no longer called patients, but they are our clients. So this is our presentation, and really we thank you very much for your kind attention. Thank you so much.
Thank you.
We have 92% of mobile subscribers in Rwanda. However, there are only 34.2% internet users, which is restricting online health engagement. There is slow rollout of some systems such as Ubuzima, EMR, which is active only in 15 districts, yet there are 30 districts. This is limiting nationwide patient access to digital records. We used to have verbal consultations online. We had 2 million plus users registered, but we still had challenges as low digital literacy and internet access keep many excluded. We have another problem of community tools, such as the community EMR, which shows strong usability for community health workers, but inconsistent adoption across health services. We also have other problems such as low digital literacy, weak interoperability, poor infrastructure still hinder effective scale-up. The root cause of this problem is that there is digital health tools are not designed with interoperability, usability, and inclusivity at the center. This is because of lack of user-friendliness, stems from inconsistent application of user experience and patient-centered design. Patient-centered design is limited due to minimal involvement of patients, caregivers, and community health workers. End-user involvement is low because development is largely driven by vendors, donors, or implementers rather than participatory co-design. Participatory co-design is not prioritized as governance frameworks emphasize technology deployment over usability, equity, and human-centered design. Tools are often complex, poorly localized, and not user-friendly. So the vision of our project is a patient-centered, inclusive, and interoperable digital health ecosystem in Rwanda, where every individual can meaningfully engage with healthcare services through intuitive, accessible, and integrated digital health tools, leading to improved health outcomes and equity in care. The objectives of our project is to simplify, localize digital health tools, design and adapt digital health tools that are user-friendly, multilingual, which means English, French, and Kinyarwanda, and culturally localized, ensuring accessibility for diverse patient groups. Second objective is to apply systematic user interface and patient-centered design principles This means to embed human-centered design methodologies and usability testing as a standard step in digital health development. Third objective is to increase end-user involvement in design and testing. Actively engage patients, caregivers, and community health workers in co-creation workshops, pilot testing, and feedback loops. Fourth objective is to shift development from tech-driven to user-driven, to establish mechanisms that ensure digital health projects are guided by end-user needs and clinical workflows, not just vendors, not priorities. Fifth objective is to strengthen governance, to prioritize usability and equity. This means to develop and enforce national digital health governance frameworks that emphasize participatory design, usability, and equitable access alongside technology deployment. And these objectives directly have a direct goal, which is one of the SDGs, which is good health and well-being. The background of digital health journey. The digital health journey started a long time ago. We would say that in Rwanda it started in 2006, where OpenMRS was introduced in the country. I don't know whether this is visible. Okay. OpenMRS was introduced in 2006, and by then we still had a challenge of IT infrastructure gaps. Then in 2012, the DHIS2 and RHMIS were introduced in the country, but it still had a challenge, which is system integration and data standardization. In 2016, Bubble Telemedicine and AI-powered virtual consultation were introduced in the country, but it still had user adoption and trust in digital consultations. In 2020, we had COVID-19 digital responses, accelerated adoptions. The challenge were rapid scaling during pandemic pressures. In 2025, we have EMR, HIE, and other health and the Health Intelligence Center, and other AI-driven analytics. The challenge with this is long-term usability and continuous innovation. We've also done a landscape analysis of the maturity levels of the digital health interventions in Rwanda. So looking at the 7 enabling environments, for the leadership and governance, we've given it maturity level 4 out of 5, which means that it's an expanding level. And the reason to this level is because we have strong governance, but it also lacks patient-centered design. For strategy and investment, it's also expanding, which is level 4. Planning exists, but gaps hinder full adoption and patient engagement. For policy and regulation, with level 3, which is establishing, we have progressive laws in place, but compliance and enforcement are still lagging. Workforce, we've given it level 3, which is establishing, because we still have low digital literacy among community health workers, and patient drives poor digital tools adoption. For infrastructure, we've also given it level 3, which is established. We still have infrastructure gaps, equitable patient access to digital tools. This means that in one area, we actually have enough infrastructures, but in rural area, there are some parts which don't have infrastructures. Services and applications, which is our main concern in this project. We've given it level 3, which is establishing. Device tools are in use, but they are fragmented. They're not interoperable. They need harmonization and better user engagement. Standards and interoperability, which is also a root cause of this project. We've given it level 3, which is establishing. There are strong foundations, but it has limited nationwide implementation. Looking at the National Digital Health Strategy, looking at some points that aligns with our project, the vision and mission of this strategy empower patients, improve outcomes, and reduce wait times. This exactly aligns with our project because we want patient engagement in this project. So this vision and mission align exactly with our project. Another point is patient-centric care. Patients are at the core of healthcare delivery. Key patient outcomes: access and engagement, feedback loops, health education, secure messaging, remote monitoring, data privacy, integrated care, and digital literacy. All these are part of our project. Supporting initiatives are user interface focused design, feedback portals, health education, messaging platforms, chronic disease applications, and digital literacy programs. Activities and outputs that are going to be followed in this project. The phase number 1 will be about research and assessment. We are going to do digital literacy assessment among the community health workers and also the citizens, which are patients. We are going to map tools, existing tools and gaps. We are going to make a user journey analysis, do the user interface and user experience evaluation and infrastructure assessment. The output of this phase will be a landscape report, personas, gap analysis, literacy metrics, and interoperability metrics. During phase 2, we're going to design and develop, and this is going to take 4 months, from the 4th month to the 8th. During this phase, we are going to start with the national user interface and user experience guidelines, patient engagement frameworks. Offline tools are going to be developed, multilingual interfaces, accessibility features, and integration protocols. The output of this phase will be a design manual, a prototype mobile application, accessibility framework, API specs, and localization toolkit. During phase 3, it will be a pilot implementation phase, which is going to take from the 9th month to the 12th.
My name is Alice Tengiyumva. I'm representing the Group 4, and I'm a medical doctor by background. And I'm being tested here by the team as well, since I'm the only non-IT personnel in our group. So our project is on interoperability of digital health systems in Rwanda, a situation analysis of maturity and strategic alignment. So this is the group behind all the good work that you'll see today. So it's myself with Michel and Florentin, Claudel and Providence. And they are all experts in the digital health field, except me. But now I'm an expert. So Rwanda has done tremendous work in terms of digital health solutions since 2009, when the rapid SMS was launched for maternal and child health. And we continued with the DHALP and OpenMRS. And up to now, we have a national digital health strategy plan, and which emphasizes on interoperability and enterprise handling. And we also have data protection law, which also emphasizes on the health information exchange. And then we also have our health sector strategic plan and national strategy for transformation, which also emphasize on digitalization and most importantly, interoperability of the systems. So unfortunately, even if Rwanda has made so much work on improving digital health solutions, we still are at level 3 of maturity for standards and interoperability. And because the systems remain siloed and the data exchange is partial and the standards adoption are not really complete. So our project aims to assess the current interoperability maturity of Rwanda digital health systems and identify actions needed to advance beyond the level 3 maturity level. This ought to be done by the end of October 2025. And our objectives are to map and evaluate the extent of interoperability of our systems, both in private and public sector, and then also identify some barriers and enablers to the contribution of Rwanda's maturity level, as well as propose actionable recommendation to reach the maturity level 4 to 5. So as I said before, Rwanda has many systems, but what stands out is that these systems are still siloed, and they all do not, they are not ready to connect with HIE, and even if there are many, they all lack, they all do not have the ability to be interoperable, so that we can say that we are at the last level where all the system talks to each other and it helps us make good decisions as our level of policy making. So this is how the landscape of Rwanda systems are in terms of interoperability. As you can see, most of them do not reach, the highest is maturity level 3. So we have identified the root cause as being a fragmented health information system, which is the contribution is on the systems that we're using do not comply to the interoperability standards as we should, even if the national standards, the National Digital Health Standards Plan has rolled out different standards. We still do not comply with them, and we still have limited infrastructure in terms of connectivity and weak server capacities, and we depend mostly on external donors, and we still have low health workforce literacy when it comes to digital health and how to use digital solutions. So even if the national digital health strategy emphasizes on strengthening integration and interoperability of health information system, we still have a gap of implementation, which is the implementation is still partial, as I said, and it leaves Rwanda at the medium level 3 of interoperability maturity level. So The scope of this project is to cover national facilities, both private and public, up from the national level to community level, and also assess interoperability maturity levels in terms of data exchange, integration, standards, and standard compliance. And we also aim to reach out to different geographic locations, including urban areas and also rural areas. We still have more infrastructure issues when it comes to power and connectivity, but also look at national coverage, especially on the health information exchange, which is the interoperability area that the Rwanda will be using. So our steps on implementations are to consolidate evidence on current interoperability maturity, adopt and enforce standards, and activate all our HIE registries, and also prioritize some systems, and then strengthen governance and also train workforce for more accountability and right personnel, and then monitor our indicators, track how we move from level 3 to 5. So it's a good thing that our national policies align well with digitalization and interoperability, which is going to help us in sustainability. And then we aim also to blend with government budget and donor support, as well as including the private sector, and then also work together with different associations, whether medical and other health professions to educate the health workers on digital literacy, and then also try to invest in connectivity, power, and then also other long-term ICT maintenance. So these are our resources that we have used, including different national health priorities. Yeah, thank you very much. And it was an honor to have this course with you. And now we can say we are expert in digital health. So yeah, thank you.